So basically here, we are planning for the senior seasons of life. However, and she's not here, I don't think, is Sylvia here? Anytime I give this presentation, I want to begin it by honoring two people who've made a big difference in my life. Ed Chandler, Pastor Chandler, and then Sylvia. Ed has gone to his rewards, and Sylvia is still working as hard as she can on Facebook and messages and so on and so forth. So they are doing it the right way. Let's put it that way. What is the purpose of the workshop? It really is to empower you. It's really to simply say to you, there's ways in which you can be empowered at your stages of life that can make a big difference. And there's the 4 topics. We're going to talk about the economic things. We're going to talk about your health. We're going to talk about your relationships and then the spiritual. Because here's the deal. Paul said, I've run the race. I've kept the faith. I've finished. I see the line. Well, we haven't crossed that line yet. You're still here. You're going to spend thousands of heartbeats in the next 4 hours. And I want that to be done well. So the purpose is empowerment of us. Okay? We used a method called the Socratic method. When I was in college, I was a philosophy and religion major in college with the idea of going on to seminary. And Socrates basically had these questions that were intuitive. In other words, they were penetrating. They were to say, think about the question, and then you give the answer that's best for you. So I'm going to give you data, I'm going to give you information, but you have to ask the questions, answer the questions for yourself. And if your thought is, I'm here to entertain, I'm not. I don't have enough heartbeats to entertain. Okay? I'm here to simply say, here's what 40 years of medicine and a few years of pastoral has taught me that might be of help to you. So that when you cross that line, good and faithful servant might be what God says of you. Here's the most important question of the morning. How long do you think you're going to live? Now, we kind of don't think about it. That might sound a little bit morbid, but actually everything is predicated upon your answer to that question. A lot of people answer that question, oh, well, I don't know, my parents lived to be 72. If I make it to 72, I'm happy. Or all the men in my family die at certain ages. In other words, our mind has a set point, but in reality, how you spend today is in part based on how you answer that question. And at the back of your handout, you're going to have a series of questions. I'm asking you to fill those in, if not today or this morning as I ask them and you think about them, or during your lunch hour when you're back there, or especially tonight. But if you wait until tomorrow, then it's too late. Then you've already missed the opportunity to really grasp what I'm talking about. How long do you think you're going to live? Now, you're going to be like, I have no idea. I'll ask the doctor. And the doctor's going like, I have no idea either. Okay, but in a way, much of what you do today is predicated on how you see that answer. How long do you think you're going to live? There are 2 populations of seniors. And in reality, in my master's in public health, I want to point out the 2. One group is basically those seniors who are controlled by a disease. And it's sad. And I have folks who've got the cancer, the heart disease, the diabetes, all the autoimmune stuff. And they didn't earn it. Most of the people go like, where did this come from? But here's the dilemma. Much of their schedule becomes the doctor's schedules. How many people here have gone like, yeah, my social life anymore is my doctor's appointments? And you're going like, is this all there is? No, then there's the end of it. But sadly enough, and I'm going to use the metaphor, frankly, not to in any way be negative, but to simply say it kind of reflects that. And that is those folks who have to live at a nursing home or assisted living home. They're not there because they want to be. Nobody ever says, you know, when I get to be 82, I just want to go and live in the manor. It's not that way. That's not in the back of the computer. But that does happen. And so those people's lifespan is really based on a bell-shaped curve. A bell-shaped curve simply means in medicine, if a person has a certain medical, example diabetes, and they're going like, I can't feel my feet, okay? They got peripheral neuropathy. Their kidney condition is getting worse. We can almost project the lifespan because the end organs that are now being affected tell us how long they'll be able to hold up. Do you see what I'm saying? So sometimes disease controls a person, and their lifespan is based on that disease. I can tell every one of you in this room right now, yours is not. Period. You wouldn't be here if it was. you would be in a nursing home, or you would be homebound, or something of that nature. So guess what? You're not in the first group. Now, it could happen someday, but you're not there today. The second group is this: those who control the disease. Now, I have some folks who beat their chest and they're going like, I don't want to be on any drugs. I'm 97 years old, and I'm going to die healthy. And I'm going like, the game's not played that way. You live long enough, you're going to pick up a pair of glasses and say, I need these bifocals. That's usually about age 40. Okay, you live long enough on the coast, and your eye doctor's going to say, you got cataracts. If you ask the eye doctors, they'll say everybody's got cataracts if they're over age 50 to some degree. You just pick it up. It's a part of the collateral damage of getting older. But the issue is not that. The issue is, does it control you? You may pick up diabetes. You may pick up heart disease. You may pick up cancer. But it kind of comes down to who's in control. Because if a person says, yeah, I've got this, but I still live a full and productive life, there's certain things that person has to be willing to do. For those people going like, I don't care, then guess what? The disease will run its course. And we'll see how those things turn out. So there's two populations. One population is a bell-shaped curve. The other population is a broad stair step, and that's really the good news to you. That no one can put a price tag on the end of your life. Okay? You're going to age, and here's a fundamental issue I want to bring out right now. We all age. This time next year, everybody in this room will be 1 year older. Okay? If you don't believe that, then you need to talk to me later. Because that's denial. That's aging. But that's not decay. There are people you can think of right now who are younger than you, and you're looking at them going like, they look sick. They are sick. And when you're going like, they're decaying, and frankly, you can look at your children and even your grandchildren. We used to call it adult onset diabetes, but now we call it type 2 diabetes. Why? Because the chronic diseases are jumping generations, so that the younger people, when I have a 17 or 16-year-old with diabetes, I can't say it's adult onset diabetes. Okay, it's type 2. We've had to change the label because a lot of the chronic diseases that older folks in their 50s, 60s, or whatever are getting are occurring in the 30s and the 40s. As an example of that, the youngest person I've ever had to manage a heart attack in my office due to hardening of the arteries was a 35-year-old female. Now, that's a bit of an extreme, thank God, but that also is an awakening. It's there too. Do you see what I'm saying? They're too young to have this. So in reality, I want you to begin thinking about that answer that you gave of how long you might live and put it to a broad stair-step process. That as you're getting older, you're going to pick up certain things. I get it. I'm not a drug pusher, but I'm a drug user in the sense of saying sometimes we need medications so that the disease is under control and I can do what I want to do. So I hope you can see the difference between the two populations. If you're residing in an assisted living facility, you're probably number 1. If you're visiting that facility, you're number 2. It's kind of the way it is. Now, people are living older. Look at those numbers, if you think about that. Okay? If you go back there in time, you can see that back in 1980, 32,000 people were over 100 years old in this country. Those are stats. Those are actual facts. But if you look at what's happening now in 2010, 53,000, that's an increase of 68%. Those numbers are going to go up. The question for me is, will they be in the nursing home, assisted, or will they be visiting? You have control over that. That's the empowerment principle. Social Security has made these numbers very real. I know maybe 1 or 2 who's under 65, but I'm not. And when I hit that 65 notch and my Medicare card came and all the advertisements from the pharmaceuticals and so on, and insurance companies, I realized I passed a milestone. Well, from Social Security's perspective, the milestone is I should live to be 84.3 years. And if you're a female, it should be 86. So if you are 65, you've got another 18 years to kick around just from the government's perspective. But here's the real catcher, the super seniors. If you're 65 years old 25%, 1, 2, 3, 4, 1, 2, 3, 4. 25% will be 90. 1, 2, 3, 4, 9, number 10. That number 10 will be what, 95? Yes. And 1% will be at the over 100 range. The centenarian, when you run the numbers, guess how many that is? That's 750,000. So what I'm trying to communicate is that you all are a different group of population than the average, because the average population is a mixture of the assisted living population and those who are not. You're not in that population, so you're a bit of an outlier in that sense of the word. However, you're still marching on. You see what I'm saying? You still have an opportunity to finish strong until the day you die. Or, frankly, and again, keep in mind, many things happen to people that is not their fault. They have nothing that they can control. So I'm not trying to say there's a qualitative difference. There's not. Everybody deserves our love, compassion, and caring. In fact, you and I have more of a responsibility to that population than we may have thought. Because in past generations, the children took care of them. Good luck on that one. Quality of life does not equal length of life. I have a number of folks who sat in my office time and time again going like, well, if I died tomorrow, it'd be okay with me. In other words, they're speaking out of the quality. Many of them are younger. Many of them are in their 50s. The quality of life does not, if I can live to be 100, then I've had a good, well, what will you be doing then? Where will you be? How will you be taken care of? What must you do to ensure the quality of life? And what I'm going to be doing today is sharing with you the best evidence-based science I know to give you a leg up. What if you lived longer than you thought you would? This is another question for your workbook, because a lot of times we tend to gauge that by our family situation. Okay, my mother died at age 63, my brother died at age 63, I'm 67, and my father died at age 81. You know, and sometimes you play the numbers. Now, some people really have good numbers. I have patients whose parents are still alive and they're in their 100s. And they're going like, I'm expecting, and so, frankly, they probably will do very well, because that's kind of the pedigree that they've been lucky to inherit. But I wanted to really begin to put in abeyance the idea of how long will I live, and what must I do now to ensure that it's a high quality until the day I die? Because you've already been selected out from the population that's not as fortunate as you are. Okay? They are the ones whom we visit and take care of. As Solomon said here in Ecclesiastes, there's a time for everything and a season under every heaven, under heaven. I want you to begin thinking about seasons, and I'm going to introduce that here in just a second. A season basically is a period of time. A season has a beginning, a middle, and an end. And I'm going to prove to you that each one of us in this room today is in a particular season. And I'm guessing that each one of us has another season in which we're going to also enter, unless your life terminates before you hit that season. And you can hopefully understand what I'm saying. When we talk about many seasons, we've gone through seasons of life. When you talk about being a child, you can talk about when you were in high school, that was a season. When you played sports maybe, or you were in cheerleading, things you did in high school, those were seasons of life, right? You enter the job market. In your middle years, those are seasons of life. You know, when you're in a military career, I'm retired from the military, and that was a season, but when the day at 25 years came, they're going like, here's your watch, not. Have a good day, door, go. And we're like, got it, it's time. That season ended. And in the senior seasons, there are seasons to be thinking about that we're going to talk about this morning, in terms of health, in terms of finance, in terms of closure, and in terms of legacy. Because my prayer for all of us is that we finish strong in the sense of God says good and well done, servant. Here's our dilemma: failure to plan. Millions have not planned for the senior seasons. Okay, 48%, these are actual numbers, have no idea what it's going to take. They're kind of guessing. They're kind of throwing something against the wall and hope it sticks. Now, here's the deal. In the military, we always go to war with a plan, but the plan never works. okay? Because conflict changes the plan, but you always have to have a plan of some kind. And that's the whole point there, is that having a plan doesn't mean that it's going to work perfectly, but it's better than no plan, because no plan is planning to failure. No plan is looking around saying, who's going to take care of me? And then finding that the world doesn't knock on our door. When you look at this one here, this is what scares me because I deal with it in the clinic. It's almost like when one's 65 years old or 68 years old or whatever you want to call your retirement, a lot of people get in the lazy river of life and they just drift. And you may not be there, and I hope you're not, but let me tell you, I know you know friends who are. They're just out there trying to find the pleasure of life. They're trying to play catch up from childhood or whatever. And that's a scary way to go about it. No focus, no purpose. A lot of other seniors that I deal with are the pinball type. They're doing fine until there's a crisis, and then they knock on the door. And I've dealt with so many crises. That's on a weekly basis. And that is, well, I didn't know that my husband would die, and now I'm here in Florida, and my kids are up in Minnesota or Alaska or whatever. I'm like, well, what's the plan? No plan will accelerate your decay. No plan is to really find yourself in life going like, I have no purpose, no real meaning for life at this point. Consequently, a lot of people are just going like, when's the clock going to run out? Like in a basketball or football game, there's 5 seconds to go and you're ahead by 1 point. You got the ball. What are you going to do? You're going to run the clock out. You're going to grab the ball, fall on the ground, and let the clock run out. Is that a good plan, though? Well, here's the deal. There are crises at many levels. As I've said already, my hope is to empower folks with a sense of control over your life and focusing on what might be the bigger picture so that you can feel like whatever you put together as your plan is the best you can do. That's all the introduction. Okay? That's to get you warmed up, to see if you're with me. I'm seeing one person's already left, so that's not too bad. Okay, we've been defined by Medicare. Whether you like it or not, if you're going like, no, I like my TRICARE standard, but I'm 65 years old, and the government says, forget TRICARE standard, it goes away. If you don't sign up for Medicare, you don't get your TRICARE benefit. Real simple. We decided your birth date has told us something about you. You now are a senior. Okay, you get this card now that doesn't have our Social Security on. As a senior, though, I would suggest to you there's 3 seasons of your life. Now think about that. 3 seasons, beginning, middle, and end. We've had seasons as children. We've had middle-aged seasons in careers. And there are senior seasons of life. Now, in this definition that I've created, I have to tell you, I had to figure out, well, what do I mean by that? How do you kind of encapsulate it so people can understand it? But it's not a perfect example. And what we're going to be doing with all 3 of these seasons is building a pyramid. The pyramid is going to have a base to it, financial. Second level is going to be health issues. Third level is going to be closure of relationships. And then the 4th level is going to be the spiritual. Why are you really here? What's your purpose? So on each of those seasons, I want you to understand there's going to be a pyramid. Why is that? You don't want to live a life with regret. You don't want to go like, I wish I were dead. And I'm going to show you some numbers about that. You don't want to really wake up and go like, what's it really all about? I've missed the boat. I'm just of no value to no one anywhere. The pity me party, frankly, that we're all susceptible to. So we're going to be talking about what are your plans for your future? Now, some of my patients are aware that I've declared this past week I'm going to be retiring from primary care, seeing patients on a daily basis, because my wife and I have entered another season. God has said it's time. And I'm in the process of helping my patients get a better doctor because they're going to get a better doctor. I've been working on this part of it because it's a season. But what's the plan? Because guess what? There's more to be done. Even if you're going like, I'm retired and I play golf, and there's nothing wrong with any of that stuff. I'm not here to value judge anybody's decisions. I'm just simply to say, do you have a plan for what you're doing with your life right now? So here's some more questions. What is your current senior season? Now that's by your age. If you're 67 years old, you know you're in the first season. If you're 77 years old, you're in the second. If you're 91 years old, you're in the third. And I'm going to show you that you're going to be a different person in each one of those seasons of your life. You just are. Just as when you think back, when you were in high school, you were in that season of life, of adolescence, but you're not the same when you're in your 30s, hopefully not, right? Hopefully you're not the same person when you're in your 50s and you've gone through a career as you were when you were in your 20s. If you are, then you're in trouble and so is your family. So we are truly different as we go through these different seasons of our life. And my prayer is to help us maximize them. Now, here's the tough one. It's a conundrum. Are you open to change? Are you open to learning something new? Are you open to being, okay, God, I don't have control over everything, but I'm going to trust you? If you're not, if your hand in life as you get older is more of a clutched fist, that will be depression, that will be anxiety, that will be alcoholism, that will be or if your hand is more like this, the older I get, hopefully the more open my hand becomes. Because I want God to show me, what is it all about?